I don't know if any of you saw the news earlier in the week, and this is about changing the future. The future is here. This little girl, Amy Fraser, have you noticed she's got this prosthetic hand? Which is really amazing, because if she didn't have this, she would have to have had her toes grafted onto her fingers. And her family didn't really accept this, as that was the proposition from the health service. What her father did was went online, and he Googled a few things, and he came up with a 3D hand that he'd seen online. It's a 3D file. He downloaded that file. Okay, he downloaded that file, and for 50 quid, he printed his daughter a 3D hand. And she was shown using this. Absolutely amazing. That is the power of putting people in charge of their own healthcare. And it's frustrating that that wasn't an option for her from the start, but I was really, really inspired by that story. So what's the story for Lancashire? For Lancashire, what we're aiming to do is to obviously share data. We talked about that today. We're going to empower people and enable them to live independently. And I've tried to overlay the strategy for Lancashire against what people would need. So at the top, this is a kind of Kaiser thing that many of you will be familiar with. It's very important to me that whilst there are people with high need, we don't ignore people who potentially are healthy and well or have one long-term condition. So that's what our strategy is all about. Some of you will have seen the diagram that we presented last time, and I'm going to give you 3 examples of how in Lancashire we intend to deliver this kind of vision. So I've got an animation on here. What we're talking about here is sharing information. So these are the organisations in the public sector at the bottom here, and they are sharing information in some form or way. What we're talking about in Lancashire is setting a structured approach that allows information to be controlled and owned by organisations, but actually being shared. And typically this is characterised by relatively small amounts of data being cycled around the system. This, in effect, is what Blethen, is that the correct pronunciation? Yep. Was talking about what they've done in the EPSOS project. It's the same underlying technology. I'm not going to talk about that now on here, but we can have a session afterwards if you want to talk about that. So that's fairly straightforward. New to the NHS, not new to the world. But I want to take it a step further. What I want to suggest we do is, as we are sharing our information in the public sector, I want it to be aggregated. I want a data aggregation level at what we're calling the Citizen Wellbeing Platform. This is a proposition for in Lancashire, everybody would have one of these. Not necessarily everybody will use one, but everybody would have one, will have the ability. And as data cycles round here, it slowly builds up a lifelong longitudinal health record. And from the outset, we want to build a consent model in there. And this is the revolutionary bit that hopefully would help Liz and her family. I want to shift the emphasis of data managed in silos down here, to the citizen. And that citizen, that person, whether it be health or social care or whatever, can then choose to share that data with whoever they wish, be it private enterprises, charities, third sector. So it's about building this up. The application layer on here is all about open APIs. It's probably the wrong wording, and we are maturing this strategy as we go through. So the emphasis of what we want to do is to give citizens control of their information, visibility of what's being shared about them. Then we bring in technology. At the moment, technology generally comes in to an organisation is centred around a pathway or an organisation. What we're proposing to do is to bring data into the patient's record, their held and controlled record, and then allow that to be federated or shared on demand to the organisations that need it, as and when they need it. And the citizen will be in control of that. And what I'm aiming to do is to bring lifestyle and health and social care data, a range of technologies. From a supplier's perspective, the proposition is, instead of having to engage with all these organisations down here and the complexity and expense of doing that, what you're really engaging with in the future is the citizen and the interoperability level up here. So this is going to change. I hope it's going to change. And I hope in the future people like Liz will benefit from this kind of revolution. Just one final thing before I finish, and Liz will be pleased. I hope I've recouped a couple of minutes. Anybody heard of the tricorder challenge? Yeah, I think this is really incredible. What I talked about the last ecosystem event was exponential change. We've got to think of healthcare delivery and health and care delivery in terms of exponential change, not in terms of linear. The world is going to change radically. The 3D printing I showed you at the beginning, that is going to get, that is a Star Trek replicator in a few more iterations. What we're going to see, and what I'm showing you here, is the tricorder challenge, which is something that Qualcomm have put out there. And although this sounds like it's in the future, I don't think it's very far away.